Hi everybody, my name is Takoja Stewart and this is my What is Happening in Healthcare presentation. I did my presentation on the COVID-19 virus and the effects that it has on hospital staffing, now and whatever. The most thing that I'll be talking about is the nursing staffing and just staffing in the hospital general, and how it affects and how COVID has basically affected it and, things that, we can change and stuff. For the first question, it says, what is the main idea? And the main idea of this presentation altogether is how the pandemic of the coronavirus SARS 2019 virus has impacted the hospital in many ways, including staffing, financial, logistics, and etc. The frontline healthcare workers around the world have shouldered the burden of treating a pandemic while continuing to provide essential health care. So basically all this is saying is that the impact of what COVID, had when it first started back in 2020, I believe, of how it is impacting the staffing, and them continuing to still provide good care. It says what is happening or what has happened. I said what is happening is that due to the virus and the rapid growth of cases and the virus, the hospital and its staff is overwhelmed with the care responsibility for these patients or those patients, period. For more than 1.5 years later, after the first cases of COVID-19 were reported, the pandemic continues to affect communities and has pushed our healthcare system to a brink. So all this is saying is that basically, and since COVID has started, since we have those cases reported, it has been affecting communities nationwide. Like, when we have the lockdowns, I know everybody remembers the lockdowns. We had to stay in for months at a time, and how that affected our community and how we had to socialize with our community. That really affected us in a big way. It says, why did this happen? I said limited hospital staffing has happened due to the rise of COVID-19 cases and who and how are needed to treat this patient. Nurses are experiencing burnout because of the rapid cases the hospital are seeing. Much of the struggle comes from the rapid changing work environments where healthcare workers are experiencing painful encounterments. Despite increasing demand for healthcare services, hospital employment data shows a critical shortage of necessary staff to meet these demands. And that is exactly what's happening now, where you see that nurses are burnt out. There's like 10 patients to one nurse. It is a lot on the nurses and just, the CNAs that help, the medical assistant, the LPNs, anybody that help. It is a lot on the hospital as a whole. What was the cause of action? The cause of action for burnouts and limiting staff are systematic change. Individual efforts to improve burnout are helpful, but just not efficient enough. Instead of lectures and classes, long-term investments in addressing the facing healthcare workers alongside advocacy for more supportive work environments. So altogether, we just need to do a better job at, talking about burnouts and stuff. Who is involved/impacted? Any healthcare professional can be impacted and or involved, but more than likely the nurses are the ones more impacted. Nurses, who make up 59% of the world's healthcare force, have to cope with nonstop overtime and burning out at dramatic rates. The nurses have the highest rate of COVID-19 infections. Since nurses are always the ones working hand in hand, side by side with these patients, they will be the ones to contract the diseases and stuff. And that's why you see the most burnouts with nurses. How has our society, environment, and healthcare system been impacted or been affected? Our society has been affected by this virus from the loss of jobs, schools, family members, belongings, etc. COVID-19 has affected it all. There have been lockdowns to try to contain the virus from spreading and other efforts to try to contain the virus from spreading as well. Our environment has been affected by this virus in a way that it has affected global warming, water pollution, and etc. Citizens even must wear masks outside to protect themselves and even inside as well. Our healthcare system has been affected in many ways that are not that there are many healthcare professionals to take care of the sick patients. They are experiencing burnout and more. What implications for nurses and other healthcare professionals? The implications for nurses and other healthcare professionals are they are going to be cut out for their work. They will have to work harder and smarter due to this being something the world has never seen or treated before. They will have to learn as they grow on how to treat patients accordingly. Lastly, burnouts are way more current than they are now due to the fact that they are stretched out thin to provide the best care possible. In conclusion, the COVID-19 virus has impacted the world in ways that we are still comprehending and learning how to deal with. There is ineffective hospital staffing in numerous ways and to try and improve for better care. COVID-19 has impacted the world and healthcare system in ways that we are still trying to comprehend. Thank you.